Yes, a few days ago, someone asked me if men do get breast cancer. Of course, you know my answer is yes. I know that when people think about breast cancer, they mostly think about women. However, men also have breast tissues, so they can develop breast cancer. Although male breast cancer is very rare, we all know that it's not usually common, but it's more life threatening because men hardly go for checkup. Of course, our African men, yeah, you have to drag them to the hospital sometimes for just minor routine checkup. They always think they're strong, and that is dangerous if breast cancer is developing within them. Because many men are unaware of the fact that they can have breast cancer, they ignore every warning signs. They ignore every warning signs that come to them. Of course, they don't also have more breast tissue as women, so they also can ignore those signs as well. That often leads to us misdiagnosing men with breast cancer, but it's happening with men as well. But breast cancer in men occurs when abnormal tissue, that I always say before, the small amount of breast tissue behind the nipple begins to grow uncontrollably. Again, that word is just uncontrollable tissue cells that grows everywhere, abnormal uncontrolled tissue cells that creates breast cancer. We all know that. And although men have more or less breast tissue than women, the same type of breast cancer can occur in both male and female. The most common type in men is invasive ductal carcinoma, just another big name for cancer in the breast, which begins in the midgut and spread into the breast tissue. Let's ask another question. How common is breast cancer in men? Very rare. Less than 1% of all breast cancer cases occur in men. It is more commonly diagnosed in men over the age of 60. So if you feel anything, please go to the hospital, male or female. But it occurs at a younger age, particularly in those who are with strong risk. A younger version of less than 60 can also have breast cancer. If you also have more risk, what creates your risk factor? Well, age is one of them, but family history can change that dynamic. Inherited gene mutilation can also change that. Hormonal imbalance can change that dynamic as well, can increase your chances of getting breast cancer as a man. When we talk about hormonal imbalance, let's look at conditions that can increase estrogen levels or decrease testosterone level in a man that may put them at risk for cancer. Liver damage, obesity, those liver diseases, and certain hormonal treatment. Exposure to radiation can generic condition, alcohol consumption, these all can increase breast cells. Of course, we talked about obesity and previous history of cancer from any other cancer that you have can increase that. All right, on all RHS platform, I'm going to put how to examine yourself so you can catch the early signs of breast cancer. I'm going to put the examination routine on. Please look out for it. How is male breast cancer diagnosed? You may ask. Clinical diagnosis, examination, imaging such as mammographic and ultrasound. Just go to your doctor. They tell you all the image. If you don't know any names that I'm calling right now, breast biopsy, we can do that as well. And the blood test can reveal something to us, CAT scan, MRI. Just talk to your doctor. They will give you some of the tools that we use to diagnose them. It's not you're not going to be able to diagnose them yourself. Just know that if you find anything around your breast, go to the doctor quickly. Doctors classify breast cancer from age is doctor classify breast cancers from zero to age oh doctors classified breast cancer from stage 0 to stage 4 based on the size of the tumor and whether it has spread. So go to your doctor, get your stages done. Treatment options, of course, surgery, radiation therapy, chemotherapy, hormonal therapy, targeted therapy, immunotherapy. Possible complications of this breast cancer without treatment will be breast cancer can spread to your bones, your liver, your lungs, and your brain. Please go get tested. Other complications include chronic pain, lymphedema. There's just swelling due to lymph nodes removal or damage. Emotional distress, of course, this always comes with some mental health issues or instability. You have anxiety and depression, treatment related side effects, and reduced quality of life. But treatment is always better, and early testing will catch it early. You could survive it. Another person asked, can men cancer be prevented? There's no guarantee, either male or female, any way to prevent breast cancer, but risk factors exist. Risk factors can either expose you to them or can either be reduced so that you will not get them because of your previous history of other factors that are related to breast cancer. Maintain a healthy weight, that will help. Regular exercise, limit alcohol. Smoking again is in everything. Smoking has to go. How we do smoking cessation is going to be on our RHS. Please look out for that. And eat balanced diet. Know your family history. Know what's happening in your family. Know where you're from. Know what's happening in your family or what has happened in your family that you were not told. We're talking about their medical history specifically. Those who have had this history of cancer before, those are what we're talking about. Okay? Attend regular medical checkups. Man, please go. There are myths and facts about breast cancer. Let's remove some of them. Men cannot get breast cancer. That's a lie. And then a painless lump is harmless. That's also a lie. Only older women need breast screening. That's a lie. Older men as well. Breast cancer is always fatal. When detected early, many cases can be treated successfully. Know that. So what are the takeaways for this today? Breast cancer in men is rare, but awareness is essential because men often do not expect to develop this disease and they don't go to the hospitals. They don't like the hospitals at all because of sometimes it's just the cultural issues with African men, which can delay diagnosis. Becoming familiar with your chest, recognizing warning signs, and seeking medical evaluation promptly for unusual changes can make a difference. Make a significant difference. Early detection, appropriate treatment, and ongoing follow-up offers the best chances of successful outcome and improved quality of life. All right, please, that will be all for breast cancer. Let's go for men. Breast cancer for men.